Hi everyone, today we're going to discuss about dental veneers or dental laminates. What is the purpose of doing dental laminates? What are the indications? Who is the right candidate to get it? And what are the different materials which are used? Because there are plethora of materials available in the market now. So what is the right material, right choice to get the best outcome of the material? And dental veneer is nothing but a thin shell of ceramic porcelain which is pasted onto the or bonded onto your front aspect of your usually a front teeth, but it can sometimes can go till the back premolar teeth also depending upon the bite of the patient. And it usually takes about previously it was multiple sittings, but nowadays with the new advancement of the latest technologies with the CAD/CAM advancements in dental, and especially in our clinic we have a dental CAD/CAM scanning material and in-house milling machine which mills and each veneer in less than about 16 to 17 minutes. And then we need slight modifications which have to be done according to the patient's smile. And yes, there are a lot of confusions, there are a lot of doubts in people who want to get a dental veneer. So dental veneer is suitable for somebody who's got a spacing between the teeth, somebody who's got a discolored teeth, somebody who's got a chipped off teeth with any minor accident, or somebody who's got a little fluorosis stains or little irregularities on the tooth surface. These can be masked easily with dental veneers, which is a quick fix and a permanent fix. So please don't get confused that if it's a quick fix, it has to be something which is short lasting. Now the dental veneers sometimes last anywhere between 10 to 20 years. We have cases, patients who had veneers for 20 years. If with utmost care and maintenance, usually they last for 10 to 20 years. And they are permanent ones, they are not removable, they are bonded permanently onto your tooth surface. The look and feel looks like exactly like a natural tooth which is in healthy state. And by having a dental veneer, you're restoring back the original or the lost tooth structure what was previously present. Or somebody who's got a spacing between the teeth that can be closed with veneers, which looks natural. It's not like an artificial material which is stuck. And there are different materials which are used for veneers. Initially, when the veneers were started, we were using the composite veneers. But with the recent advancements, there are beautiful ceramics which have come into the market, and there's a lot of innovation happening into the translucent part of the materials. So the material which is more translucent brings that liveness to the material, and that is very, very accurate in any human dentition, because our teeth or natural teeth are not like a white opaque. They are a mixture of grey, white, dark shades, translucency. So all this can be incorporated with a ceramic or a porcelain veneer. So initially when we started with the composite veneers, we had little limitations of getting this natural effect, and the strength was not great in composite veneers. But with ceramic veneers, we have a strength close to about 800-900 megapascals, which is almost as close as to the enamel, which is a natural product of the human body. And the color discoloration is least, or I would say there is no discoloration with any ceramic or a porcelain veneers. And it can be made as thin as 0.3 of a millimeter. So imagine you're talking about less than half of a millimeter, which is just bonded onto your front aspect of your tooth to get you the beautiful results. And yes, is this painful? A few people might have this doubt. It is not painful because it is done under local anesthesia with a very minute amount of local anesthesia. Numbing gel is given, then the numbing injection is placed, just to make sure that the patient doesn't do any movements on the chair. So it's more to make the patient comfortable during the procedure. And yes, there are cases where we don't even use anesthesia, where it's a no preparation technique what we follow. For somebody who's got the smile which is inside, it is not showing, we don't have to reduce any tooth structure. In those cases, we don't have to give any anesthesia. We have to just prepare or make your tooth a little rough so that there is a better bonding. And then once the tooth is prepared, then we make a scan. So yes, we have moved from the stages of the traditional impressions. Now we are into the era of scanning. So your tooth is scanned in a real time, and a real time 3D image is produced, and everything is transparent nowadays. Everything is visible to the client. Patient can watch himself how it is getting, how the scan is performed, and once the scan is done, then we sit with the patient, then we get the inputs of the patient, the real-time inputs. So previously it was, we used to make an impression, then sit with it for days together. It used to take anywhere between 1 week to 2 weeks to process a single laminate or a veneer. But now with the latest innovations, with the latest CERAC machine what we have, which is an in-house milling scanning machine, we do it real time. So we are conversing with the patient directly. So the outcome is much better because the patient opens up. What are their expectations? We'll try to meet those expectations. Once the billing is done, we're going to put back into the patient's mouth and again check with the patient if he or she is expecting anything. A little changes. So probably they can tell me, doc, I need a little tooth which is a little twisted, or probably I want a little tooth which is a little edged out. So all these can be incorporated in real time. Real time, and since the procedure is done, scanning, and they sit with the patient, and all this is done with the patient, or patient is bringing an attendant. She wants a second opinion. Yes, we welcome that. The more number of people, the better the improvement. So we always feel in that way. So we take inputs from the patient or the attendant, then we incorporate our inputs, and then we come to a production of a laminate. And it's a thin shell. It's hardly about 3.3 of a millimeter, which is like a contact lens what you wear for your eyes. So this is milled, and then we put it back into the patient mouth, and then we do the trial. We ask the patient if he or she's okay with it. Once it is finalized, then we glaze it. So glazing is nothing but to bring that polishability, to make it glitter or to make it more polishable. The more polished the surface, the better for the maintenance. So we glaze that. That takes about 15-20 minutes. And then once it is glazed, we bond it onto the tooth's, the front surface of the tooth most of the times. And this bonding takes about 10 minutes. So what was taking about 1 or 2 weeks previously, in our clinic with the latest machine what we imported from Germany, so with the milling machine, it's called a Serac machine, we mill, I would say the whole procedure is about 45 minutes for each veneer. So we are looking at upper front 6 veneers, we are looking at about 2 hours. So we call it as a smile in a day concept, and 2 hours flat, we prepare the tooth, we scan, we show a trial to the patient, then we glaze and bond it. So all these are possible only because of the new machines which have come into the dental field. And with the new latest lens techniques, we take a photograph of the patient before, then we can also show the patient exactly how she is going to look after. So a lot of thoughts can run into the patient, so we respect those thoughts process, what's going to the patient. So sometimes they want to know how it's going to look before starting the procedure. So we have a digital smile design, it's also called as DSD, where we take the patient photographs and then incorporate whatever changes we are willing to incorporate in the patient mouth and what suits to the patient. So that is also possible. We can show you before starting the procedure, the before and the after exact images of yourself. It's not some model images what we are trying to show and tell that it's going to look like this. It's exactly your photographs are taken, then incorporated according to your nose, your midline, your lip thickness, your eyes, your position of your eyes, your eyebrows. So there are a lot of things when somebody is manufacturing or milling a veneer. It's not just you paste like a dummy white sheets onto your tooth. It has to be designed according to the patient's expressions, the patient's skin or the texture, the color of the skin, or I would say the thickness of the lips, and the profile of the patient. So all these factors go into manufacturing a beautiful veneer and placing it in the mouth. And yes, what is the aftercare after the veneers are placed? So usually the routine procedures of every 6 months, cleaning procedure is what we advise. And very rarely, yes, they do get debonded, very rarely, which happens probably 1 in 100. And that happens if somebody is consuming a lot of sodas. So those acids kind of melt the bonding. So we would advise a person who's getting a veneers to limit themselves to very, probably avoid these colas or the sodas. And the rest is all same, it doesn't get discolored, it's going to be the same after 20 years or 10 years. And the routine checkup will last, probably the veneers will last about anywhere between 10 to 20 years. And yes, what is the age limit to get a veneers done? So somebody who is above 18 or the permanent dentition has happened and the growth is stopped. So we would recommend somebody who's got, who's above 18 years is an ideal candidate to get a veneer done. And yes, we have covered what's a veneer and what's a process. And coming to the cost of the dental veneers, it has substantially come down compared to what it was costing us before with the recent advancements with the machinery. Because the traditional laminate was taking multiple visits in the span of 1 to 3 weeks, and there were a lot of indirect cost which was involved because it was done by a third party, then the dentist used to fix it. So with the newest machines, though the initial cost, the one-time cost looks high, but the material what you get is a more guaranteed material which comes with the machine. So it's all authenticated material and the number of visits are less. It's a single visit dentistry. Thank you so much for watching.